A groundbreaking new report out this morning calls substance abuse one of America's most pressing public health problems. 12.5 million Americans abused prescription painkillers in the last year. That's according to the Surgeon General's first report dedicated to addiction. And 78 Americans die every single day from opioid overdoses. The CDC says more people died from drug overdoses than car accidents or gun violence in 2014. Think about that, 2014. Chuck Rosenberg is the acting administrator of the Drug Enforcement Administration. He's here for an interview you will see only on CBS This Morning. Thank you for being here.
My pleasure.
I know you have called this epidemic unprecedented and horrific. Why is this problem still growing?
It's a great question. It's growing, and it's growing fast. And you're right, more people die from a drug overdose than from car accidents or from firearm violence. In fact, the numbers aren't even that close. We have 30,000 people who die each year from gun violence, about 30,000 each year in car accidents. The number here is 47,000.
Wow.
It's 50% higher. It's awful.
So the question is why? The
question is why. There are a lot of prescription pills out there, and here's the problem. We know that 4 out of 5 new heroin users started on prescription pills. And most of the people who start on prescription pills get them out of someone's medicine cabinet, get it, quote unquote, legitimately. And so there's a pill problem that becomes a heroin and opioid problem.
So, Chuck, I think the doctors?
I don't.
Because they're getting it from in many cases, it's prescriptions.
And in many
legally
cases,
obtained.
and in many, if not most cases, prescribed legally. So there's a lot of blame to go around. There's a lot of blame to go around. We are 5% of the world's population. We consume, in one way or another, 99% of the world's hydrocodone. That's crazy.
Wow.
That's crazy.
Yeah.
I wonder, though, does the DEA bear some responsibility? I was stunned to learn in some of the research before having you on here that the DEA sets the limits of how many pills can be manufactured. And in 2014, an estimated 14 billion opioid pills were dispensed. That seems too high.
It's very high, but we don't regulate the practice of medicine. We do allocate the amount that folks can use to manufacture. But remember...
Well, why not bring down that amount?
Well, we did. We did bring it down. But there's still plenty of capacity there, and there's a lot of pills that are going to be produced. So we got to think about fixing this, tackling this in other ways. One of those is demand reduction. You know, DEA is really good at supply reduction. We're traditional law enforcement. We attack that unholy alliance between, international cartels and violent street gangs. That's not enough. We're not going to enforce or prosecute our way out of this mess, so we have to do demand reduction, and we have to do it better.
But the Congress thinks something differently. They do think that the DEA is in part culpable. I mean, as you know, back in July...
I've heard that.
Yeah, Senator Richard Durbin said, quote, "The Drug Enforcement Agency has decided to flood America with opioid pills far beyond any medical purpose."
Yeah, I met with Senator Durbin after that and some of his colleagues, and I think there was some misunderstanding, and I hope we set it straight, but I don't think that characterization is accurate.
But that's the supply side. Back to the demand side.
Yes, sir.
And who's asking, how do you reduce the demand? Is it public education?
Right.
Is it what?
It's public education is part of it, but we've got to teach, we've got to rehabilitate, we've got to treat. An example. We have a partnership now with Discovery Education. We have created a STEM-based curriculum that we can drop into any middle school or high school in America, right? We can tell people what the science of opioid addiction is, and we can help parents and kids and teachers have conversations about it. Another example, Gail, to your question.
The National Take-Back.
The National Take-Back.
Yeah, I was curious.
Critical stuff, right? So we did it twice in this past year. Here's a big number. We took in 1.6 million pounds of unwanted and expired drugs. We do it anonymously. You drop it off, we incinerate it.
No questions?
No questions asked. Now, by some estimates, only about 10% of what we get on take-back are opioids. That's still 160,000 pounds of opioids out of medicine cabinets and off the streets. So this is a good thing.
There's a lot of work to be done, but you're saying we're doing it.
Look, the men and women of DEA are amazing. They have a really hard job. They have a dangerous job. But we need help, right? We need it from doctors. We need it from pharmacies. We need it from manufacturers. We can use help from Congress. There's a lot of help to be had.
Well, we thank you for joining us today. Spread the word.
Bringing more awareness to this issue.
Really appreciate it.
Thank you for having me.